This is GovExec Daily, where we bring you the federal stories that really matter. It's April 20th, 2021. I'm Ross John Fortuné. Last week, the federal government recommended that health systems and states pause use of the Johnson & Johnson COVID-19 vaccine following reports of rare blood clots in 6 women out of the more than 7 million people who have received the shots so far. Last week, Centers for Disease Control and Prevention Chief Dr. Rochelle Walensky spoke at a briefing about the pause and the government's role in examining the vaccine.
There may be additional cases to report. We want people who have received a vaccine and their healthcare providers to be aware of these events and report them to the CDC and FDA through the VAERS system. And the pause will allow our independent committee of scientific experts to review the safety information on this vaccine and these events to determine their significance.
The recommendation came on the heels of good news of more vaccinations being deployed across the U.S. Currently, more than 50% of adults in the U.S. have had at least one dose of the vaccine. The pandemic is far from over, however. According to Johns Hopkins University, the global death total surpassed 3 million over the weekend, with 560,000 American deaths. According to the CDC, a 7-day moving average of daily new cases of more than 69,000 is an increase of nearly 2% over the previous week. Meanwhile, the Biden administration is balancing testing and vaccinations with economic recovery. The Treasury Department announced that it had just processed a 5th round of about 2 million relief payments this month and also set up a new office in the agency to specifically lead the department's implementation of economic relief and recovery programs. Courtney Bublé writes the Coronavirus Roundup for us here at GovExec. She'll join me next to update the show on the state of vaccinations, economic recovery, and other COVID-19 related stories. Did you know that the need for broadband access is at an all-time high? As the digital revolution kicks into high gear, it's clear that state and local governments are still far from distributing broadband access in an equitable way. Barriers to reliable, high-speed broadband differ from region to region. In this Route 50 event, viewers will examine the digital divide in all 4 major regions and explore promising solutions to bridge the gap. Visit route50.com/events for more info. That's routefifty.com/events. The world reached a dire milestone over the weekend with the global death toll of the COVID-19 pandemic surpassing 3 million. As parts of the world continue to struggle with the pandemic, the United States reached a more positive milestone. More than 50% of American adults have had at least one dose of a coronavirus vaccine, the CDC announced. Courtney Bublé writes the Coronavirus Roundup for us here at GovExec. She joins me now to update the show on the state of vaccinations and other COVID-19 related stories. Welcome to the program.
Good to be here.
CDC announced a pause on the Johnson & Johnson vaccine last week. So what's the status of that? And building off that, do the states have enough of the other types of vaccine to keep the momentum going?
So the CDC Advisory Committee on Immunization Practices met last Wednesday for several hours. They went through these 6 reported cases of rare blood clots that are probably the result of the Johnson & Johnson vaccine. They're still doing more research on that. They did not take a vote yet, but they are scheduled to do so this coming Friday. They're going to meet again. Dr. Anthony Fauci said on NBC's Meet the Press yesterday, Sunday, that he doesn't believe the vaccine will be canceled altogether, but rather there will be some type of warning or restriction or risk assessment, he said, for those who could be potentially susceptible to these rare blood clots if they do get the vaccine. Now, just to reiterate, there are only 6 cases so far out of the over 7 million that have been administered. I am one of them. The symptoms have come up between 8 and 13 days of getting the vaccine. So a lot of people have had it for a long time already, and they've been fine. And White House officials and administration officials overall have been reiterating that this won't likely set back the country's vaccine progress, as Johnson & Johnson has made up a small fraction of the overall vaccination efforts. Pfizer and Moderna have really been dominating, the numbers. So it doesn't seem like it will. And sites and locations that had Johnson & Johnson are quickly switching over to the other vaccines. So as of now, it doesn't seem like it will make a delay, but that's still yet to be seen.
When you say I'm one of them, you're talking about one of the people who had the Johnson & Johnson vaccine, not one of the people who had the adverse side effects, correct?
Yes, I should clarify that. I got the vaccine, the Johnson & Johnson vaccine 4 days before the pause.
I guess I'll ask. I am a Moderna man, I guess. I've been vaccinated with the Moderna vaccine. How are you feeling about the Johnson & Johnson vaccine and all of this stuff surrounding it? Are you worried?
So initially I was worried. I'm not going to lie, seeing that notification on Tuesday morning, especially because they were all women. They were between the ages of 18 and 48, which I am within that age range. But it is so rare. And I think my concern right now is that it's really going to hinder vaccine confidence overall, or confidence in getting the Johnson & Johnson vaccine. Like I said, I got it a few days before this pause. I had, just the normal side effects on Saturday and a little bit into Sunday, but nothing severe. So I think at this point, people just really need to listen to the health officials and know that if they do this review and they say it's safe, then it is safe. And, we really can't worry if we don't need to.
Yeah, I won't go too hard on this particular editorializing hobby horse, but I do think our industry is not always great with reporting on science stories, and I think then it gets amplified and it gets to be a little bit of a game of telephone, and that can make things even more frustrating for people in the medical field. I know I've spoken to scientists and doctors about specifically this, people at NIH, friends of mine, or even my sister who's a just a regular old doctor. I guess, can you just kind of expand on the vaccine progress where we are? I mean, I mentioned up top that we're over 50%, but who's eligible, who's, what states are doing well, what states are doing poorly, how's the US looking generally?
So as of Monday afternoon, when we're recording this podcast, 50.4% of all U.S. adults have received at least one dose. Now, because Johnson & Johnson is only needs one shot, so there are some fully vaccinated people within that. And 32.5% of U.S. adults are fully vaccinated. The White House announced today that now all adults 16 and up can be eligible for the vaccine. And this was, on target with their goals. And, the Biden administration overall, like they set goals initially for when they wanted certain people to be eligible or a certain percentage or number of people to get vaccinated. But they've really made a lot of progress on those goals early, and they've been able to move up some of those deadlines. There's obviously still been some issues in certain states in getting appointments, especially when it comes to technology and booking online. But overall, the country seems to be headed in a really good direction.
So we had the budget a couple weeks ago. What's in the budget? The blueprint that the Biden administration put out, what's in it that will be part of the fight against the pandemic?
So there's so much in this budget preview that is focused on the coronavirus pandemic, as well as bolstering our long-term public health infrastructure, so we're ready for future outbreaks or pandemics. And even in the non-public health agencies section of this budget preview, the theme of the pandemic is woven into all of the sections because of how the pandemic has impacted everything. And this is with mental health and housing, Social Security Administration, domestic violence. There's so many mentions of the pandemic, but I'll just mention a few quick things. So the administration is proposing the largest budget request for the CDC in almost 20 years. This would be $8.7 billion. They're proposing the creation of the Advanced Research Projects Agency for Health within the National Institutes of Health. That would be worth $6.5 billion, and that would do federal research on cancer and other diseases. And they're also proposing dedicating $905 million for the strategic national stockpile to restock it post-pandemic and to continue some of the restructuring efforts that have begun recently. And just to recap overall, Biden is proposing $769 billion for the civilian agencies. That is a 16% increase from fiscal year 2021, and $753 billion for the national defense programs, which is a 1.7 increase from this current fiscal year.
Yeah, there's the caps removing, as we talked about on the show with Mandy Smithberger and others have really allowed, I think, the administration to try and bulk up staffing and budgets for a lot of civilian agencies. Speaking of new civilian agencies and offices, there is a new Treasury office coming. Who's leading it, and what's it going to do?
So last week, the Treasury Department announced it's created this new office to lead the department's implementation of the economic recovery and relief programs, because they were kind of like scattered into different offices before this. Jacob Liebenhoft, I'm sorry if I said his name wrong, a former Obama administration official, will be the inaugural chief recovery officer. And this office will work closely with Gene Sperling, who is a senior White House advisor, and he is overseeing the implementation of the American Rescue Plan overall.
All right, so we'll end on this. You have reported on the Bureau of Prisons, and you've attached to that report on the ways that prisons and jail systems are dealing with or not dealing with the pandemic. So this has sort of been in the news stream lately, and it's something that we've covered some. What do the numbers look like for people in prisons and jails against those who are on the outside?
So according to an analysis the New York Times published last week, in the United States, 9 in 100 people have had the coronavirus, compared to 34 in 100 for incarcerated individuals. And this rate is even higher in the federal prison population, as at least 39% have been infected. Now, I've done a decent amount of reporting over the last 13 months or so about the vast outbreaks in the federal prison system. And although the agency management has instituted a lot of mitigation measures due to the close quarters in these facilities, particularly for inmates, staff coming in and out, and facilities not always following the directives, that has led to the spread. I've talked with people working in some of the facilities fairly regularly, and they're still pretty concerned, over a year later. In the last, I want to say 5 months or so, the cases have been increasing amongst staff more than they have inmates. And there also is, I don't know the most recent update, but a couple weeks ago, we did a story on how less than 50%, I believe 49% of staff members at the BOP accepted vaccines from the agency. Now, I don't know if they've gotten them in the community overall, but during this hearing, a lot of lawmakers were a little bit surprised and alarmed by that statistic, given that, it's been such a pervasive problem.
Yeah, it's interesting with the prisons and jails, because everyone is so tightly packed that there's no level of deserving or not deserving, however you feel about people who are in prison and jails. And that's always a concern of mine when people complain, well, the prisoners are getting it before the guards. It's like, it doesn't really matter. Everyone needs to get it because they're so tightly packed. This is not something where we're kind of letting people twist in the wind because of their status, as far as being imprisoned. It's a scary thing in that sense.
And the agency did say that they are offering them to staff members first. And if the staff members don't accept the vaccines, then they offer them to inmates, as they don't want to waste doses.
Yeah, another issue here, of course, is scarcity and wasting doses and things like that. And we've been seeing that since vaccines became more available a few months ago. That said, Courtney, thanks for being on the show with us.
Good to be here.
Thanks for listening to GovExec Daily. Our show was produced by Adam Butler and hosted by me, Ross John Fortuné. We want to thank Courtney Bublé for joining the program. Our music is the song Signals by Catfish Dancing. Be sure to rate, review, and subscribe on Apple Podcasts or Spotify or wherever you get your podcasts. You can email us any feedback at podcast@govexec.com or hit us up on Twitter @govexec. We'd love to hear from you. We'll talk to you later.